Hello, everyone. This is Dr. Chamblin, and this course, Teaching, welcome to the course, Teaching Diverse Learners. So in this course, we're going to focus on students with disabilities and looking at what are some of the things that you as general education teachers need to know about the process, the referral process, your role in collaboration, and working with other professionals in the field to help students with disabilities achieve their goals, achieve the targets of their IEPs, and also so that they are successful and can move forward and actually plan and develop life after school, which is always the goal in our K through 12 system. So I'm just going to check my share because, let's see, I just did this and I want to make sure we both see the same thing. Okay, so let me check this to make sure that we are okay. Good. Okay. So I want to start with talking about the concept of inclusion and IDEA. So as general education teacher, you have probably heard of the term inclusion and you've heard of IDEA for sure, right? So inclusion is a newer term in education. Students with disabilities in our educational past were not always allowed access to education. And then when they were allowed access to education, it was usually in a segregated setting, separate school, and there was no integration of those students with general education or their non-disabled peers. And so there came this thought of when a student with a disability demonstrates the capacity or the capability, then perhaps they could go to a general education school, and there was some types of ideas where the onus was on the student to be ready or to be prepared to be in the school. So for an example, if a student has Down syndrome, it would then be based on, well, can the student do A, B, and C in order to belong and come to this local school? Whereas full inclusionists argue that if a student lives in a particular area and everyone is going to the local zone school, that student with Down syndrome should not be denied access because he or she has Down syndrome, that student should be allowed to go to the local school because the student is entitled to go to that school just as every other child in the district. So I think that we have had this particular um, controversy in schools. And when it comes to inclusion, I think we have fallen someplace in the middle. In schools where we did have special education classrooms, we saw that some students were was called mainstream. So when they were ready, they were able to be in general ed classes, but yet still that was not, some argued that mainstreaming was something that was not always good for students with disabilities because it's putting conditions on their participation in getting access to an education. Because separate but equal, so when we put students in segregated places, we put them in self-contained or separate facilities, Separate but equal has not worked very well in our country. In education, separate but equal has not worked well, has not worked very well. So there have been a lot of arguments as to um, why we need to have inclusion. And so inclusion does look different in many different places in our country and also in the world. Inclusion is a concept that is expressed very differently in schools. So dealing with right here in this country and bringing it even closer, we're going to focus a little bit more on New York State. So IDEA in 2004, when it was updated, added some more things that was very beneficial and has stayed with us and has helped the profession. For example, IEPs had added present levels of performance where we really looked at how is the student doing? Getting more information about the student and making IEPs a little bit more student tailored and looking at the strengths of the student and not just the weaknesses. Also research-based practices and our strategies and how we teach and make sure we collect data so that we can understand what's the best way an effective way to teach a student how to read, how to do math, how to work on social skills. What are the things that we need to do and what research can we do, action research, any type of research, so that we have promising practices, research-based strategies, so that we're not doing things just because they sound good, but because we know that there have been positive outcomes for that. We also have added accommodations and looking at ways to make sure that when we assess students, we are actually assessing the information and the constructs. For example, a student with a learning disability that has a problem in decoding, so that when I look at the words, I have difficulty knowing what the words are. However, student with learning disability who has a very, very strong comprehension and is able to think critically and remember things. And we are trying to test the student for comprehension and for their understanding of certain things. How do we present that? So if we present that as they have to read this test, we are testing decoding. We're not testing comprehension. So if I read something to the student and ask them for their answer, I'm now getting what they think. So now I am testing their comprehension. So these are some things that we have fought for, because if you know that student cannot decode, and so an English test, a social studies test, a math test, everything becomes a test in decoding if the format is all for the student to read it. So you're only assessing decoding. You're not assessing anything else. And so if we know decoding is the issue, why are we constantly hinging everything on decoding? So these were some of the things that have come from that, and why accommodations and testing accommodations are so important and vital. And that was just one example of many scenarios when it comes to that. We also did sharpened up the identification of learning disabilities and also sharpened and changed processes. Prior to 2004, a lot hinged on the discrepancy model, waiting for students to fail before they could qualify to get special education services. And so funding was diverted to early intervention, meaning that let's have pre-referral strategies. Let's see how the students respond to intervention. Let's do all these things in general education, and let's do them early. Let's do it when students are in kindergarten and first grade and provide all of this, and then see how the students are doing. Give them that support so that we don't have to wait until there's these huge discrepancies to then give them the services. And that's the model that most of you have probably experienced when you went to school, where you went through RTI process or you received certain types of reading materials and supports that are there as early intervention to make sure all students are able to access learning. Also, IDEA in its newer form highlighted that special education teachers licensing must be high caliber, high quality, and a focus on what is it that special education teachers need to learn in the curriculum of getting their license. So now LRE. So now I can explain LRE to you. You have already know that LRE is students with disability receiving to the maximum extent feasible their education with their non-disabled peers. So if the general education classroom is the least restrictive environment, how do we move from least restrictive to most restrictive? So in special education, we have the continuum of services. And in our continuum, as we move towards the end of the continuum, we get more restrictive. So the least restrictive is general education. Then we have general education with consultant services. This consultant can consult with the teacher and professionally develop the teacher to understand a condition of a student in the class, or the consultant can work with the student directly. That is more restrictive than general education class. We then have general education classroom that is co-taught with a general ed teacher and a special education teacher. Usually there's a teacher's aide, paraprofessional in the room. That then becomes more restrictive than consultant services. Then we have general education classroom with resource room, related services, all types of pullouts. Some of our related services is speech and language, counseling, occupational therapy, physical therapy that usually happens. And so as the student is pulled out from the general education classroom, that becomes more restrictive. So the more time spent outside of that general education classroom, the more restrictive the placement is, because you're moving away from the least restrictive environment. Then we have full-time special education classrooms, so self-contained classroom, that is more restrictive. Special school, where the student now leaves their locally zoned school and they're going to a special school to receive services all day. And then the most restrictive is a special facility. It could be a hospital or residential care where a student is living there 24 hours and they're receiving their education in the facility. Okay, let me just double check and make sure you see what I see. I'm going to make sure to share. Okay, doing very good. Okay, so now it's your turn. Excuse me, I have a little cold. Which situation is the most restrictive? We have Ella, and Ella attends an ICT class at PS 118 in Queens. We have Jonathan, who attends the Rebecca Center School for Autism in New York City, actually in Manhattan, but Jonathan lives in Brooklyn. Then we have Sarah, and Sarah attends the Alden Terrace School in North Valley Stream, where she receives resource room, speech and language services, and counseling. So which student is in the most restrictive placement? Right, Jonathan. If you said Jonathan, you are correct. So Jonathan lives in Brooklyn, but he is going to a special school that is not his own school, and he is receiving special services all day at the Rebecca Center in Manhattan. Who would be next? So we have Jonathan, most restrictive. Who would be next? Right, right. Sarah. So Sarah has also the next level of restriction in that has all those pullouts. And so the least restrictive environment in this situation would be Ella. Correct. Very good. Okay. So just to summarize, the more time a student is away from the general education classroom to attend services, the more restrictive the program becomes. So when you as a classroom teacher is in a meeting and you're invited to a meeting to help the student and you want to add, the student should get counseling, they should get this, they should get that, they should have this, and we want the students to have a lot of services, the administrator may pull back. And so the student may need all of these services, but it is our responsibility as a CSE chairperson, as an administrator, as a team, to always keep in mind, is this the least restrictive environment, and how do we look at that? And there are many parents who come in and they want the most restrictive environment. They will go from their students being in a general ed classroom and they want them in a residential facility. And so there might be reasons for that, and it might be legitimate and warranted, but it is our responsibility to think about, can we meet the students' needs in a less restrictive environment? We're going from general ed to residential. So that's something that we have to think about, and we have to consider that during the process. Okay, so here we go. Your turn again. So here you have an opportunity to earn some extra credit. Okay, so let's see, where's my notes? Okay, so get a sheet of paper and write down the numbers 1 to 6. What I am going to do is I'm going to read the name of each student and I'm going to tell you their placement. You are going to write numbers 1 to 6. Number 1, the student who is in the least restrictive environment, all the way to number 6, the student who is in the most restrictive. Let me just double check to make sure that we are seeing the same thing. Yes, we are. Okay. Okay, so I'm going to read to you the students. You're writing from 1 to 6. Number 1, who is the least restrictive? Number 6, who's the most restrictive? You are going to see a space for extra credit in Canvas. So write down the numbers 1 to 6 in Canvas, and then just write your answers of the student, just the student name. Okay, ready? Okay, so let's look at Angelica. Okay, so Angelica is a 5th grade student at Washington Rose Elementary School. She has a hearing impairment, but functions well in class. A specialist meets with Angelica's teacher twice a month to professionally develop Angelica's teacher. Number 2, Brandon. Brandon is a 1st grader at Forest Road Elementary School. He has 2 teachers, Miss Smith and Mr. King. Number 3, Trevor. Trevor is a 12th grade high school graduating senior at Frank Carey High School in Franklin Square. Trevor has 5 periods, and all of them are Regents level courses, and he's actually taking one AP course. Trevor is in courses that are Regents level and would be considered general education classes. Next one, number 4, Jennifer. Jennifer attends Madonna Heights, a 24-hour care facility, and she attends school on the grounds of the facility. It is a residential care site. Ziggy. Ziggy loves the color blue. She is the star of the week in her 4th grade class, where she leaves every day from 10 to 11 a.m. and walks down the hall to Mrs. Hill's resource room class. Ziggy also has speech on Wednesday afternoon, and meets with the counselor, Dr. J, on the 2nd floor every Friday from 1 to 2 p.m. And the last one, Chris and Maniu. Chris and Maniu are best friends. They are in a self-contained class for 2nd and 3rd grade in their local school. In their class, there are 12 students in the class, and they have 1 teacher and they have 2 teaching assistants. So we have Jennifer, Angelica, Ziggy, Brandon, Trevor, Kristen, Maniu. Of those 6, rank from 1, who is in the least restrictive environment, all the way to 6, who is in the most restrictive environment. Submit your answers on Canvas. Okay. So free and appropriate education. So IDEA and IDEIA, where the was improved, FAPE means that all students are entitled to a free and appropriate public education. This includes access to the general education curriculum. So this added something where not only are the students supposed to be allowed into the room, but it is up to the teaching staff to make sure that the curriculum and all things are accessible to the students. So this widens the scope and also raises the level of challenge for what teachers need to do when we have students with disabilities in our class. So it is no longer appropriate to teach to the average child that doesn't even exist, but to know how to differentiate and how to do whatever we need to do to give those students access to the curriculum, to the information, so that they can achieve the learning targets. Okay, so we talked a little bit about the basics of the lay of the land of special education. So who are these students in special education, right? Can anybody be in special education? Who are the students? What are the characteristics? What is all that about? So that's a whole class, a graduate class. So to give you the quick summary of that, in order for a student to qualify for special education services, they need to be found to have a disability. The disabilities have to fall under one of these categories. It can only be one of these 13 categories. Then after the student is found to, through assessment, is in the category or has one of these 13 disabilities, then whatever services, what needs to be done, that's a whole nother piece of the process. So some of these might look brand new to you, and some of these you might already know. So let's test you and see how much you know, because you probably said, oh, I already know all of this. Okay. So you know all of this? Write down 1 to 13 on a piece of paper. I'm going to read the definition, and then you are going to write the disability category. So for example, I'm going to read a definition. It will be the definition of orthopedic impairment. You're going to write down orthopedic impairment, numbers 1 to 13. Then after we do this, I am then going to give you the answer, and then I want you to, for extra credit, it's easy, tell me how many you got correct. Okay? So that's another extra credit opportunity. So here we go. Let me just double check to make sure that we are, you see what I see? Okay, yes, you do see what I see. Yes, okay, great. So you have the 13 categories in front of you. Number 1, this category, individuals in this category have moderate to severe impairments in both vision and hearing, causing such severe communication and educational needs that programming solely for children with deafness or children with blindness is not appropriate. Number 1, which one is it? Write it down. Number 2, an impairment in the loss of vision that, even when corrected, affects educational performance. It may be mild to moderate to severe in nature. Students who are blind are unable to read print and usually learn to read and write using Braille. Students with blank, low blank, can usually read when the print is enlarged sufficiently. Number 3, this category includes any individuals with 2 or more disabling conditions. However, this category often includes intellectual disability as one of the categories and is usually used when disorders are serious and interrelated to such an extent that it is difficult to identify the primary area of disability. It does not include deaf blindness. So this has more than one disability, but one of them has to be an intellectual disability with another disability. Number 4, with or without amplification. This disability affects educational performance and developmental progress. The impairment may be permanent or fluctuating, mild to profound, unilateral or bilateral, but this category includes impairments not included under the definition of deafness. Number 5, This disability or impairment is associated with physical conditions that seriously impair mobility or motor activity. This category includes individuals with cerebral palsy, individuals with disease of the skeleton or muscles, and accident victims. Number 6 describes significantly below average intellectual functioning as well as concurrent deficits in adaptive behavior. It is manifested between birth and age 18 and negatively affects educational performance. Number 7, a developmental disability generally manifested within the first 3 years of life. Major characteristics can include impairments in communication and reciprocal social interaction, resistance to change, engagement in repetitive activities, and unusual responses to stimuli. Number 8, individuals with this disability have hearing impairments so severe that processing linguistic information through hearing is severely limited, with or without amplification, and educational performance is negatively impacted. Number 9. This category includes individuals with a condition in one or more of the following areas over an extended period of time. 1, the inability to learn due to intellectual, sensory, or health problems. The inability to build and maintain social relationships with peers and teachers. 3, inappropriate behavior and affect. 4, general pervasive depression or unhappiness. 5, tendency to develop fears or physical symptoms associated with school and personal problems. And 6, schizophrenia, a disorder in perception of reality. According to the federal definition, this disability is not intended to apply to socially maladjusted children unless they are also characterized as having serious, and I can't say that because that is the label. Okay. Ready? Number 10. This category includes chronic or acute health-related difficulties that adversely affect educational performance and are manifested by limited strength, vitality, or alertness. It can include such health problems as heart conditions, sickle cell anemia, lead poisoning, diabetes, and epilepsy. It can also include attention deficit hyperactivity disorder. 11. This is an acquired injury to the brain due to external force resulting in a total or partial disability, psychosocial impairment, or both, which negatively affects educational performance. And it does not apply to congenital or degenerative injuries or to brain injuries acquired during birth. 12. This category includes disorders of articulation, fluency, voice, or language that adversely affects educational performance. And last, number 13, this category refers to a disorder in one or more of the basic psychological processes involved in understanding or using spoken or written language, which can result in difficulties in reading, writing, listening, speaking, thinking, spelling, or mathematics. The term does not apply to physical, does not apply to children with problems that are primarily the result of visual, hearing, or physical disabilities, intellectual disabilities, emotional disturbance, or environmental, cultural, or economic disadvantage. So there you have it. 13. Okay, so I'm going to now give you each in order, and then you can let me know how you did. You might also encounter some of this on a quiz, just saying. Okay, so number 1 was deaf blindness. Number 2, visual impairment. Number 3, multiple disabilities. Number 4, hearing impairment. Number 5, orthopedic impairment. Number 6, intellectual disabilities. Number 7, autism. Number 8, deafness. Number 9, emotional disturbance. 10, other health impairment. 11, traumatic brain injury. 12, speech or language impairment. And 13, specific learning disabilities or learning disabilities. Okay, so there you have it. How did you do? Did you get them all right? So don't forget to put the number that you got right on the first try. I would be interested to see how you did. So I hope you honestly did it. Don't make up a number and say, oh, I got 13 right, and you didn't even do the exercise. So make sure you're honest, okay? All right. Okay. So there are students who go through the process and they may or may not be in one of those 13 categories, or they may. But through the process, we find that they are not eligible for special education services. However, they still have a disability. So there is a 504 provision. And in this provision, it is that this law says you cannot, it prevents discrimination against an individual with a disability by any institution that receives federal funding and provides FAPE. So you may have a student with a learning disability, or you have a student, let's say, with diabetes, and they might not necessarily fit the criteria where they need to receive services or an IEP, but they need testing accommodations because it is warranted because of their disability. So to say that, well, since you're not eligible for special education services, we're not going to give you testing accommodations. That is a violation. You're discriminating against that student. And that does happen quite often, where parents have to fight for that. Where you have a student who has some processing issues or physical issues due to being to a disability that does affect their processing or does affect them in some way. So 504 provision, and you might have something called a 504 plan, where a committee, you might have a 504 committee in your school, make sure that they write out a plan for these students so that they're not discriminated against, and articulate what services or what are some of the things that we need to do to support them and make sure that we're not discriminating against them because of the disability that they have. Okay, so we finished so quickly today. So please make sure that you look at the other exhibits that are in this Let me see, let me go to the first page. So please make sure that you go through this module and see any other exhibits that are in the module. It might be a reading, or you might have modules where you see a video or read an article. So each module will have a lecture, or it will have a video, or it will have an article, or it will have a book chapter, or it might have 2 or 3 things to support your thinking with the objective of what we're talking about for the week. And then there will be some type of assessment at the end. So please engage. This course should be really a lot of fun. It should be very interesting when you look at all the different videos and information. And of course, the lectures are going to be fantastic. And so I hope that you get as much out of this as possible. So thank you for your participation today, and thank you for listening to this information, and I look forward to seeing you next week. And